This week's topic, hidden thyroid issues and lupus. If you've already been tested for any thyroid issues, this is something that you still need to watch because I'm going to be going over different types of thyroid panels and why we are lacking in that area of testing and what you can do about it so that you can be tested properly and have a proper diagnosis to reduce all of those lupus-like symptoms. So if you're still suffering, or still talking about how you have fatigue, brain fog, weight gain, hair loss, this is the video for you. Hey warriors, if you're a lupus life hacker, thanks for the support. If you're new and you want to stay in the now, make sure you subscribe and click on that bell so you get notified of our weekly video release on every Thursday. All right, let's dive in. So you click on this video because you're having symptoms of hair loss, brain fog, weight gain, anxiety, depression, joint pain, all of the lupus-like symptoms that we're used to experiencing. Well, they do sound just like thyroid dysfunction. It could be Hashimoto's, it could be hypothyroidism. I do talk about these in detail on a blog. I'll have that link below. For now, I'm just gonna go over symptoms and testing. So symptoms of thyroid dysfunction. Fatigue, even though you're sleeping for 8 to 10 hours a night, even if you're not because of insomnia, which is probably part of the problem, I do still suggest this is something to look into. Weight gain, or maybe you have an inability to lose any weight. Mood issues, do you have mood swings? Do you have anxiety, depression, hormone imbalance? If you have PMS symptoms, if you have irregular periods, infertility, low sex drive, if you have muscle pain, joint pain, carpal tunnel syndrome, if you have cold hands and feet, or if your body temperature's usually low 98.5, it could be lupus related as well. It also could be your thyroid. If you have dry or cracking skin, brittle nails, constipation, brain fog, poor memory, or concentration. If you have any neck swelling, if you're snoring a lot and it's not sleep apnea related, if you have a hoarse voice, these sound like lupus. And that's the crazy part, because a lot of times we're gonna be thinking, we're thinking it's lupus. And a lot of times too, our doctor's like, oh, it's just lupus. But you know what? It's always important to be thorough, because this is an opportunity for you to decrease symptoms when you find out the actual cause. Hashimoto's is a Th1 dominant autoimmune condition when the Th2 part is suppressed. And lupus is a Th2 dominant condition. So if your immune system is pushed too much from Th2 into the Th1 zone, it can trigger disease. Your immune system has two types of responses, Th1 and Th2. And I do talk about this in one of my blogs, the innate and the adaptive immune response. I'll have that link below as well. Th1 is where your cells fight bacteria, or if you have a cold or something like that. So it's like a quick, rapid response. Your Th2 is a different type of response. It's a delayed response. This is where Th1 cells couldn't handle that attack initially, so Th2 comes in. It attacks more powerful invaders, and that's where it attacks pathogens outside the cells, like in the blood, for example. If you have a poorly regulated immune system, which we definitely do, Th1 and Th2 can be too dominant, and that's where the reoccurring imbalance happens, and they're fighting all the time, and that's where our immune system is always fluctuating, and that's how disease develops, because we're not in homeostasis or an optimal balance. Optimal is the key word, and I'm going to be talking more about that later on. Now, a lot of autoimmune diseases like adenomyosis, lupus, thyroid issues, they are estrogen dominant triggers. Our hormones may be in normal range when we get our blood work checked, but this isn't as accurate, especially if we're not taking the blood work at the right time, especially if it's just blood work, you're not doing a saliva test. Also, the ranges are grossly out of date. So a thyroid panel in conventional medicine. I'm going to actually list the ranges in the description below, and that way you can just copy and paste it from there. But what I'm going to explain is that in order for you to show no symptoms of thyroid dysfunction or any autoimmune disease, you have to be in an optimal range, and that is a range that is much smaller. as compared to the ranges that our lab work shows. If your doctors ever say to you your blood work's fine, but you're sitting there and you're in so much pain or you're so exhausted and you just can't explain it, this is why. It's because your blood work is not an optimal range. You may be a high normal or a low normal. The reason for that response is because doctors practice emergency-based medicine. So when they're in school, they're not taught how to treat chronic illness and find the root cause. They are taught how to treat emergencies. So they give you two options: a pill to regulate your symptoms only, or a procedure to remove organs or to stop something from happening.
Like what you see so far, subscribe and click on the bell so you don't miss out next week on our new video. Now back to the topic of the week.
It has its needs and I fully support it when needed. However, with chronic illness, this is not something that is ideal. Hence why we're always suffering 24/7, because it's not the correct approach. Optimal range comes from doctors who practice functional medicine and integrative medicine. I will leave a link below to where I got these ranges from, and you can learn more about that also in another blog that I will leave a link below. Those who practice integrative medicine will have the highest rates of success when treating their patients. And success to them is where their patients go into remission and have no side effects of any medications. And that is exactly what we practice here at Lupus Health Shop. So the full thyroid panel that you should be requesting has 6 different types of testing. You should fast, and also do not take any type of supplements or medications the morning of. If you're on thyroid medications right now, don't take it. Generally, when conventional doctors are testing for lupus, or when general doctors are testing for thyroid issues, they're testing your TSH levels only, and that's actually not an accurate way to test for it because that hormone is in your pituitary gland. It's more so describing what your pituitary gland is doing and not what your thyroid is doing and why it's dysfunctional. That's why the functional route tests all 6, including the antibodies. It's important to test for antibodies, your thyroid antibodies, because that's going to be a precursor in letting you know if you are more likely to develop autoimmune thyroidosis or Hashimoto's. This is an autoimmune condition and it is something that can be treated as well, and we can reduce the symptoms. There you have it, warriors. Do what you need to do to be successful. Lupus doesn't have to take everything from us. We have to learn how to work around it, and we have to learn how to be proactive so that our doctors will work with us as a team in reducing our symptoms and increasing our quality of life at the same time. We talked a lot today about thyroid issues, our immune system, and blood work ranges. You might be thinking, okay, now I have all this. How am I gonna treat it? So next week, I'm going to be releasing a video on how to treat these and what types of medications are best for you. There are going to be a few different ones because, again, we're not all the same, so there's no standardized approach. It's very individualized. But until then, I have these 2 videos right here that are going to talk about different types of symptoms that you may experience, hair loss, also different careers at home with lupus. Check out those videos. They'll keep you busy until next Thursday. Thanks so much for watching. I appreciate your support. And I'll see you next week. Subs if you loved it, thumbs if you liked it.